Hello friends, today we are discuss about the homeopathic therapeutics of burns. I think this is on first time on YouTube. So we'll start. Let's go. There is I, five medicines, important five remedies, which are important according to the exams and also in practice. So we'll start. So the first remedy is aconite napellus, which is also known as rapid worker in acute cases. It acts like a miracle and immediately after accident. It is also used immediately after accidents. It helps to contract the nervous shock. So the Naconite napellus is very good medicine for the nervous shock. First, in aconite napellus, we see the first degree of burns, where the skin is lost and ionic imbalance take place. Now, aconite is also used in violent and severe pain in affected part. So the affected part there is a burning type of pain, congestion of the burnt area with inflammation, burning and sudden swelling. So there is watery discharge from the wound and pulse is full, strong and vigorous. So next, and next symptom we are seeing there is a tachycardia and upper and lower extremities are cold and sweating on forehead. Now we see the mental symptoms of the aconite napellus. So there is a found in acute condition of burn. So we are seeing the mental symptoms on acute conditions of burn. So the patient is very anxious, nervous irritation, great fear of death. Patient thinks that he going to die and nothing in the going to save him. So he wants to say goodbye to everybody. Fear, anxiety, and worry makes him restless. So this is the reason of restlessness in aconite napellus. So there is a fear, anxiety, and worry. So it makes him restless. So the patient predict the date and time of the date. Also, there is a very important symptoms of mental symptoms according to the exam. Now the modalities of the aconite napellus: the aggravation in the evening at night, amelioration in open air, exposure to burn area to the atmospheric air. Now we see the second medicine, Cantharis, in which we see the first degree burns, which is caused erysipelas vesicular type of ulceration. So in this Cantharis medicine, we see the ulceration and the affected part burn like fire. There is very characteristic symptom with severe pain and inflammation. Oversensitive to the affected part, inflammatory condition has tendency to go into gangrenous state as there is lack of blood supply. So here, because of the lack of blood supply, there is tendency to the inflammation condition has tendency to go into the gangrenous condition. And second, the the cutaneous circulation is burnt off. So because of burn, there is a cutaneous circulation is burnt. Sudden loss of consciousness and stupor, red face due to go into the suppurative stage. Now see the mental symptom of Cantharis: confused and overwhelmed, various various stage ideas crowding in the mind, mental excitement, restlessness, patient want to move his place, delirious condition of mind. Now we see the modalities. Now aggravation from touch, drinking cold water or liquid, urinating, and amelioration by soft touch. Now we see the third medicine, causticum. So choice when the bad effect of burn are observed. So there is best remedy when you see the bad effect of burns. Now in second, the skin is raw and sore due to burns. Old burns are very much irritating and troublesome to patient. Now patient says, I have never been well since that burn. There is very characteristic symptom. Based act on complications of burn or the bad residual effect of the burns. Throbbing and stitching type of pain in raw area. Now see the mental symptoms. The great sympathy for the suffering of others is the important mental landmark of this remedy. Sad and melancholic mood, very anxious, mind confused and mental exhaustion. Now great fear of death, insanity after suppression of skin eruption. Now see the modalities. So aggravation in clear fine weather, clear bright sunlight, dry cold wind, and amelioration by in damp weather, warm air, and wrapping in the bed. There is a very characteristic modalities ameliorating. Now see the fourth medicine arsenic album, which is very characteristically used first and second degree burns and scald, vesicular and formed with blister, intense burning of the part. So there is burning is a, we know the trio of burning. There is arsenic. Area around the burns is inflamed. Skin around the burn has got tendency to gangrenous state, painful and tender to touch. Part are sensitive and patient does not allow to touch. Lancinating pain with tendency for separation. Dirty blackish brown discoloration of the skin. Suppuration with high degree of temperature with cold sweat. Now see the mental symptoms, very much restless and want to change the place often. Patient thinks that he will not survive even though the doctor is attending to him, and it is useless to take the medicine. Can't tolerate the small and slight of the food. This is very characteristic symptom that the patient does not tolerate the smell and sight of the food, which is cause nausea. Patient is selfish and suicidal tendency, but due to lack of courage, does not attempt it. Now, modalities aggravation from cold air, cold drinks, cold food, wet weather, midnight, and amelioration by warmth in general and head up position. Now, see the last medicine, Arnica montana, burns with local inflammation of the area and around the lesion. Now, cellular tissue are damaged, which cause extravasation of the fluid, thus the part become idiomatous. Skin color change from black to blue with offensive discharge. Patient has tendency to go into the shock. Now see the mental symptoms, sad, melancholic, irritable and fearful. He is afraid and get up in the bed at night. Now mental symptoms are due to effect of burn, shock. Does not like to touch and talk. All parts are sore. All parts are sore and tender to touch. Now see so there is an end of burns. In burns, you can also includes the general symptoms of medicine. So thanks for watching.